Today, nearly 72 million Americans rely on Medicaid for health coverage. It was 60 years ago today that President Lyndon Johnson established the government health care plan for the poor, as well as Medicare for the elderly. This year, Medicaid is set to undergo significant changes enacted through the president's tax and spending cuts law. For tonight's interview, we are joined by Michael Cannon, a director of health policy studies at the libertarian think tank, the Cato Institute. Michael, thanks a lot for being with us. Big changes coming to Medicaid. They were framed in the conversation a lot about in terms of dollars. What, from a policy perspective, should we know about these changes to Medicaid?
The first thing to know about Medicaid is if it were a drug, the FDA wouldn't approve it. There's not substantial evidence that it improves health or saves lives, yet it spends $1 trillion per year subsidizing the most expensive health care industry in the world. And this law doesn't really change that very much. Instead of growing at 4.5% per year under prior law, Medicaid spending will grow at 2.7% per year. That's not even a cut. The government's going to keep spending more and more money. And, you know, the United States has the most expensive health sector in the world, and Medicaid is a major contributor to that because it doesn't try to get health insurance companies or hospitals or pharmaceutical companies to be more efficient. All it does is throw more money at them, encourage them to be even less efficient. And until we have some major changes to the Medicaid program, we're not going to get a more efficient health sector or more universal health care.
So it sounds like, obviously one of the criticisms was that people would lose coverage. And so I'd like to get your thoughts on that. But you're arguing it's neither, whatever happens on the coverage front, you're saying that the claims about savings and improving the system, that's not going to happen either.
You know, if federal Medicaid spending goes from growing at 4.5% per year to 2.7% per year, the states were expecting the difference. And so some people, and there are some rules that say you have to have work requirements and more frequent eligibility determinations. Some people might lose the subsidies that they would otherwise receive. But you know what? Nobody has to lose any subsidies if states want to replace that spending, that federal spending, with state spending. But everyone assumes that they won't. What does that tell us? I mean, states could raise taxes and fill in that gap. But if everyone assumes that they won't, that tells us that states don't want to do that because it's not popular with their voters, that current Medicaid spending levels are not popular with voters because voters won't support the taxes necessary to pay for existing Medicaid spending levels. And in a democracy, we should not be funding government programs at unpopular levels.
On the question of a private or a public private market solution to our healthcare issues or to people who are poor and who are on Medicaid, people might find that attractive in the sense that if they believe, but they also know that in the private healthcare market, insurance market, people have a lot of upset with that as well. So how do you have free enterprise with a system where people think, well, gee, the private insurance isn't so great either?
Most of the things that people hate about private health insurance in the United States are things that the government encourages or requires private insurance companies to do. And if the government got out of the way, gave people an option to buy health insurance outside of, say, Obamacare's expensive regulations like they can do in U.S. territories, then health insurance premiums would plummet for most individuals and employers. It would become more affordable. They could purchase long-term health insurance that stayed with them between jobs so they don't lose their jobs when they lose their health insurance when they change jobs, and provide more secure access to health care when they get sick. Right now, those same government regulations that are driving up health insurance premiums are also encouraging health insurance companies to skimp on care and coverage for the sick in really a race to the bottom. And this is former President Joe Biden's economic advisor, Michael Guru, did the research that showed that that's what's happening in Obamacare.
Unfortunately, we're out of time, an enormous topic. Thank you for helping us tackle a little bit of it. Thanks a lot, Michael.